Hi everyone, this is Dr.RUkmani Choudhary and you're watching Everyday Health Cell. My today's topic is erectile dysfunctions, ED. So in today's video, I'll be talking about erectile dysfunction, like when it is normal, when it is a medical problem, medical emergency, when you see your doctor, what are the causes behind this? There can be physical causes, psychological causes, medicinal causes. This can also happen after having certain drugs and the required tests. There are certain tests to be done. And the management part, how you can manage at home without even medication. You can treat it easily by doing some exercises, and yes, later on allopathic mode of treatment, surgical part, and best effective homeopathy medicine. So I requested to watch complete video for complete information. If you're watching first time, please like, share and subscribe my channel for further notification. So let's start with ED, erectile dysfunction. So ED means there is a difficulty to attain a proper erection or inability to maintain or even initiate an erection. So if this happens, sometimes not persistently or not for a longer duration. So this is not a cause of concern. This can be due to psychological or due to stress, any problem. This can be temporary, transient, but this is persistent. This is for a longer time and you feel it every time for 6 months. Yes, medically it is believed that if you facing this problem for a 6 month, then medically this is known as a erectile dysfunction. Physical causes and medicinal causes, and there can be psychological causes. So in physical causes, there are certain diseases and their treatment. These are diabetes, so you can have diabetes and due to that you may develop erectile dysfunction. There are certain heart diseases because you have narrowing of the blood vessel, so there is a less blood flow to that part, so you have erectile dysfunction. There can be thyroid disorders, there can be hormonal problem, and these hormones are like low testosterone level. Sometimes these structural problem and anatomical problem, and these are Peyronie's disease, and sometimes injury to that part can develop later on in the erectile dysfunction problem, and sometimes cancer therapies like radiotherapies to that part only, radiotherapies and even cancer to that part. So cancer and cancer treatment can cause metabolic disorder, obesity, high cholesterol level. These also contribute to erectile dysfunction. Now the medicinal part. Cancer medicines, these are cancer drugs, even certain heart disorder drugs, and your drugs for depression, if you're having any medication, or anxiety. These drugs also contribute in erectile dysfunction. Now the psychological one, known also the trigger one. So these can be depression, anxiety, emotional health, or fear of intimacy. So treatment part. So treatment in allopathy, there are certain drugs. The first step is therapeutic treatment, certain drugs, and these are like PDE5. So these are phosphodiesterase inhibitors 5. So these are the certain drugs initially, but all the drugs you are supposed to take doctor guidance, right? And these are known as the blue pills or the Viagra's one, but again under doctor supervision. There are certain vacuum therapies, mechanical one, and yes, these are surgeries, surgical treatment are there. These are implant. If you have more difficulty, if your case is severe one, then there are penile implants. Tests required, the range of tests. Why? Because there are so many problems you are having. You may have diabetes, the high cholesterol level, heart diseases, or sometimes prostate, sometimes there are different causes. So for that, ruling out for the hormonal causes, diabetes or heart problem, there are series of blood tests done. You can manage it at home. Management part, you can easily manage by doing some exercises, and these are pelvic floor muscles exercises. You can do certain Kegel exercises, or yes, you can even do walk or like brisk walk. So these improves your hormone, these improve your blood circulation, so in turns you have a better erection. So just start having walk, even brisk walk, jogging, and pelvic floor muscle exercises. The effective homeopathy medicine, there are couple of medicine in homeopathy. These are on the basis of individual characteristics, in homeopathic individualization. So you don't have to buy all the medicine, not required. And if you're watching on YouTube, you may find all medicines link below in description box. So these are on the symptom basis, on the age group even, on which age group you fall, what symptom you have, and what is your case. Are you having other medical problem, associated medical problem, whether you have diabetes. Staphylococcus aureus is the medicine that is used in erectile dysfunction cases when you have excess masturbation habit, or you have excess sexual excesses are there. So in these kind of cases, staph of remedy. And you have urine problem as well, you have bladder infection, cystitis. So all these are the indication of staph area. 1 or 2 drops. You may even have different form of the medicine, as this depends on the company. So this is the liquid form. So just take with the help of dropper 30 or 200 potency, 1 or 2 drops 2 or 3 times in a day before having your meal, till the time you start seeing difference. Comes selenium. Selenium is a choice of the remedy when you have there's a sadness, and you have erectile dysfunctions, and you have forgetfulness, and particularly this is used in student when they are overexerted physically, mentally. Yes, and these are the indication of selenium. 1 or 2 drops, again 1 or 2 times. Caladium is given when you have sometimes diabetes, and you have flies attract to your sweat sweet, itching of that part, these are the indication of caladium. Again, your mag. Conium mag is given when you have erectile dysfunction. With that, you have prostatic troubles. So this is given in the later age of the life when you have prostatic problem and you have urine problem. So conium is the choice of remedy. 1 or 2 drops, 1 or 2 times. Agnus Castus. So Agnus Castus is given when there is no desire. Erectile dysfunction is there, but with no desire diminished, low libido, diminished libido. So these are the indication of Agnus Castus. 1 or 2 drops, again 1 or 2 times before having. These are not the limited one. There are other medicine as well. Anacardium is there, Lycopodium is there, Bariatricap is there, acid phos, Dr.RUkmani, R41, Demia plant, Demia gram mother tincture, Demia gram forte, drops, and Ashwagandha, Vighania somnifera. All these medicines depend on the patient's age bracket, requirement, and other medical problem. So hopefully this will give you some amount of help. If you find this video knowledgeable, informative, please like, share, and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep watching, keep supporting. Thank you so much. Thank you.